It can feel impossible to shield children from hearing about the violence that's happening these days, especially when a mass shooting hits so close to home. But how can you bring up the topic in a safe way? Well, joining me now is Dr. Lewitzke. She's a psychologist with Bright Pine Behavioral Health. Thank you so much for joining us here, Doctor. I was telling you I was at the scene yesterday, and I spoke with a grandmother who grabbed her grandchildren and said, run. And she says, how am I going to explain this to them? What's your advice for talking about these kinds of topics?
Yeah, I appreciate you having me on here today to discuss this. And I first and foremost want to say that my heart truly does go out to all the families and the victims, and especially the children who have had to endure this horrible tragedy. So first and foremost, I mean, this is an unfortunate situation that happened because they happen at random. And in these types of situations, talking to your kids is also going to be really difficult. But this is also the third mass shooting that we've had in Michigan, the second in Oakland County. And I'm a mom as well of two young children. So this is also just like hearing about it has deeply impacted me, and thinking about how I'm also going to be possibly talking to my own kids about this. So first you want to assess your child's understanding about the situation of what happened. And then from there, lead an open-ended conversation, but also allow the child to lead that conversation and to ask those questions on what they need to know. And you want to make that age appropriate too. You know, like my kids are 4 and 6, that conversation is going to look much different than someone who's 10 and 12 or someone who's 16, right? But what we know is that when these situations happen that are so unfortunate, that safety measures do need to be taken place as a family. You know, they start learning about, unfortunately, these mass shooting situations early in preschool on how to handle those. And as a family, we also may need to take safety measures, like reassuring that your child, you know, letting them know that they are still safe, that you're taking all the precautions that you can as a parent to keep them feel safe, but then have these open-ended discussions on what you can do. Unfortunately, I mean, it's a conversation nobody wants to have, right, with their families. But that may be where we are at now, that we may start having these conversations with our kids as well, too.
Is there ages when you should start these conversations? I know you said it's age appropriate. Is there a time where you're like, hey, don't talk about this until they're in middle school, or it should be really happening earlier?
Well, they are starting to talk about them early on in preschool, you know, and that's a horrifying thing, because when I was growing up in school, this wasn't really a thing that is occurring as often as it is now. And there's also something called the it could have been me phenomenon too. So a lot of people who have not even been firsthand witnesses to it, they could still be feeling the aftermaths of this tragedy just because they're relating so much to it. So that's going to help lead, I think, some of those conversations as well, because you're going to be feeling a lot of anxiety, frustration, and confusion about this whole situation. And those conversations need to happen with your kid. Like, maybe you don't feel ready to go out in a public space yet, but you're going to eventually going to have to start feeling some comfort to go out or take your kids somewhere. I mean, it is summertime, but that's kind of like that, I guess, teetering of how your comfort level is going to be for that, because some anxiety is normal, especially after this situation, right? Like, that is a typical response you're going to feel. You're going to feel heightened anxiety, but you don't want it to be crippling to the point where you're not doing anything with your family, or missing out on experiences, or you're avoiding public places, you're starting to distrust other people, because those are a lot of things that happen in these events. Even if you didn't directly experience this tragedy, that you could still have that secondary, it could have been me phenomenon, that psychological reaction to having it, or you could still be having a lot of anxiety following it. So just having those conversations with your kids, and you don't have to just explain every detail. That's why we say age appropriate, to discuss with them what type of plans could we have as a family to have these different safety measures in place. Or you know, I say, like, scan the room like a lifeguard, but still, because, you know, anxious, I guess what I'm saying is anxious parents are going to have anxious kids, right? So
interesting.
Right, so you can scan the room like a lifeguard, making sure, like, you know, you're going to be more aware of your surroundings, but then also be present for your kids too, so they're not feeling off in that anxiety. You need to have healthy coping behaviors as a parent and model those for your kids, and really have those conversations with their kids to start it. Have the child ask the questions that they need to have, discuss a safety plan, either maybe with you and like your significant other first, or the child's parents, and then talk about it with the kids at an age appropriate level. And then have those healthy coping behaviors that you're modeling for your kids too. And if your child's having anxiety following this, you could certainly just monitor what they're drawing, what they're writing, or even what they're playing. Like, if they've heard other things or heard their parents talk about, they might be modeling some of those. Like, that's how kids usually process a lot of their emotions when they're really young, is through play, right? And then you can look at some of the drawings or writings that they're having and open a conversation up from there too.
I wonder, how do you know when it goes from sort of healthy coping into something that maybe needs more serious help? How can you monitor that?
Yeah, that's a really great question to have too, because when you think about anxiety, like having some anxiety is actually a good thing because evolutionarily it's helped us to survive. Having too much anxiety though, or even too little, it's about finding that healthy medium. So if you're having too much anxiety, that's going to be a lot of having panic, disrupted sleep, withdrawing from different situations, not being present for yourself or your family or others. And that's where it's going to be leading to be more distressful. So finding that healthy medium point. So if you're feeling anxious going out, in public, which most of us are, I myself, I'll be honest, like even having small kids. I mean, just 2 days ago, I was talking with my friends that we wanted to go to a splash pad, and they have kids similar in age of mine, and so it's about having that healthy medium of being able to still cope with your anxiety in a healthy way. So you can do grounding techniques too to help you feel present in that moment. Something that I do when working with patients is 4 to 8 breathing. So inhaling through 4 counts, exhaling through 8, and this is then going to help you feel more present and calm. It's going to calm your parasympathetic nervous system, which is your body's like stress response. You're going to feel calmer in a public setting, maybe if you're feeling very heightened anxiety right now. Also, there's the 5, 4, 3, 2, 1 grounding exercise. So the 5, 4, 3, 2, 1 method is where you're looking in your environment because you're maybe really panicked and your anxiety is really heightened, and you're going to look for 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and then 1 thing that you can taste. So that's going to help you feel more present in your environment too.
Oh, great advice. And I love saying that it starts with our parents can model this. Really, really grateful for your time. Thank you so much. This again, Dr. Kat Lewitzke, we appreciate you.